Toothworms and Spider Juice, read by Natalie Barton. Chapter 11, Comforting Inventions and Yankee Ingenuity. If you needed a dentist in colonial America, you would have gone to the local blacksmith, wig maker, barber, or anyone else who did dentistry on the side. From the early 1600s to the 1700s, most colonists in America had no access to professionally trained dentists. As a result, many colonists suffered from tooth ailments. When home remedies didn't work, these early Americans had little choice but to go to one of these part-time dentists. One of the most famous of these was Paul Revere, 1735 to 1818. Besides being a master silversmith, engraver, and patriot, he practiced dentistry by doing fillings, cleanings, and constructing bridges and dentures. By the end of the 1700s, more and more medically trained dentists had relocated to America. After arriving in the New World, they traveled from town to town, letting people know of their coming by announcing themselves in posters and handbills and in newspapers. They would advertise with phrases like, "Painless dentistry by Dr." One of the first native-born full-time dentists in America was Josiah Foster Flagg, 1763 to 1816. Some reports say that he was trained by either Paul Revere or by a Frenchman named James Gardet. Josiah Flagg practiced a full range of dental skills from prosthetics to orthodontics. His most notable contribution to dentistry was the invention of the dental chair. He took an ordinary Windsor chair and added a headrest and an extended armrest for holding instruments. The great influence that Americans had on dentistry came with the founding of the Baltimore College of Dental Surgery in 1840. It was the first dental college in the world. Formal dental training and modern techniques at the school made the United States the world leader in dentistry. Besides the white dentists practicing in America at the time of the opening of the Baltimore College of Dental Surgery, about 120 African Americans were practicing dentistry. These African American dentists had learned their trade by working as apprentices under white dentists. In the 1800s, not many white dentists would work on African American patients, so there were opportunities for black dentists. In 1869, Robert Tanner Freeman made history by being the first African American to get a proper dental education. Denied entry into independent dental schools, he was in the first class of 6 students to graduate from the Harvard University School of Dental Medicine. In 1881, the Howard University College of Dentistry in Washington, D.C., was founded to educate African American dentists. In 1886, another college, Maberry Medical College in Nashville, Tennessee, also began educating African Americans to be dentists. These 2 colleges were responsible for training African American dentists in the United States until desegregation in 1954. From then on, no student could be refused entrance into any dental college because of his or her race. What about women? Were there any women dentists in early America? Way into the 19th century, few women practiced dentistry unless a male family member taught them to assist with their patients. None of the newly formed dental schools would admit women as students. But then, in 1866, after much determination and a refusal to give up, Lucy Beeman Hobbs graduated from the Ohio College of Dental Surgery in Cincinnati, the first woman in the world to obtain a dental degree. Ida Gray was the first African-American woman to graduate from the University of Michigan School of Dentistry and receive a dental degree in 1890. The 19th century brought many breakthroughs in dentistry, and many were American inventions. One American, Charles Goodyear, 1800 to 1860, discovered vulcanized rubber in 1839, which aided in the making of dentures. Goodyear, working in his birthplace of New Haven, Connecticut, received a patent for the vulcanized rubber in 1844. This cheap, easy-to-work material could be molded to fit the mouth and made a good base to hold false teeth. One of the greatest contributions to the medical and dental fields was by an American dentist who, in 1844, discovered the practical use of anesthetics. Before that time, people had to endure surgical operations and dental treatments without anything to numb the pain. Horace Wells, 1815 to 1848, a dentist in Hartford, Connecticut, discovered a way to use nitrous oxide gas on his patients when doing extractions. He experimented on himself first by having another dentist come to his office with an inflatable bladder, rubber bag, to administer the gas. Wells inhaled the gas and became unconscious. When he awoke, he found that one of his teeth had been extracted without any discomfort. His discovery allowed him to perform needed extractions on patients who had stayed away because of fear. At this time, however, dentists had no way of telling how much gas they were giving a patient because they had nothing to regulate it. Dangerous overdoses were common. Because of the fear of giving patients too much gas, Horace Wells lost his followers when he demonstrated an extraction on a man who had not been given enough of the gas to deaden the pain. Wells was called a fraud, and the gas went into disfavor for decades. Unable to bear the criticism and lack of appreciation for his discovery, Wells committed suicide at the age of 33. In 1864, after his death, Horace Wells was finally given recognition by the American Dental Association and the American Medical Association for his work in the development of anesthetics. Another American dentist to discover an anesthetic for practical use was William Morton in 1819 through 1868 of Boston. He did the first successful demonstration of ether anesthesia. He first experimented with animals before trying it on humans. He administered the drug with a glass globe into which a sponge saturated with ether had been placed. The patient became unconscious after inhaling the drug, and Morton was then able to extract a tooth without hurting the person. But Morton, like Wells, never received immediate credit for discovering a use for ether anesthesia, and ended up with a ruined dental practice. He died a pauper in 1868. At present, ether is no longer used in most medical and dental settings, but nitrous oxide is still administered to patients who request it. If the gas is used, it is given not to make patients unconscious, as in earlier times, but to get them into a relaxed state while awake during their dental procedures. Nitrous oxide is contained in a tank and delivered from a gas system, combined with oxygen into a nosepiece. Gauges and valves regulate the dosage safely. After the dentist completes his or her work, the gas is shut off and the patient is given only oxygen to breathe, clearing out all traces of the gas. The use of local anesthetics given by injection began in 1858. These drugs, developed from cocaine, numbed the tongue, took away feeling and taste, and made the fully awake patient comfortable and pain-free. The first of these drugs was Novocaine, but in 1948, xylocaine became the most commonly used local anesthetic in dental offices. Another big leap in the advancement of dentistry came in the 19th century by yet another American dentist, Willoughby D. Miller. Miller was educated at the University of Pennsylvania. He later became the first foreign professor at the University of Berlin, Germany, where in 1890 he discovered that acids were created on the teeth after food mixed with bacteria and its byproducts in the mouth. The acids decalcified the enamel on the teeth, bacteria entered the hole, and decay resulted. Miller's initial theory was carried further by later dentists until it was understood that this accumulation of tooth-destroying acid, which is called plaque, must be removed daily or it will multiply, causing cavities and gum problems. Dentists began teaching preventative measures by advising the use of anti-plaque toothpastes and mouthwashes, and stressing flossing and brushing, plus regular professional scaling. Besides the American dental inventions and theories, one other major discovery that contributed to changing dental and medical treatments forever was made by a German physicist named Wilhelm Röntgen, 1845 to 1923. He developed the use of X-rays by discovering that rays from electric currents could penetrate solid objects. When he exposed photographic films to these invisible beams, a shadow picture of the object appeared. The first radiographs or X-ray photos of teeth were taken in 1896 by physicist Walter Kung in Frankfurt, Germany. Soon, many experiments were done, with no one knowing that long, daily exposure to the X-ray beams could cause malignancies, cancer. Early X-ray machines were crude and slow, taking as long as 20 minutes or more for exposures. One American dentist in the 1890s, Dr. C. Edmund Kells of New Orleans, Louisiana, held film plates positioned in the mouths of hundreds of patients while taking X-rays of their teeth, ignorant of the damage the beams were doing to his hand. First he lost his 3 fingers to cancer, then his whole hand, until his suffering led to suicide. He was one of many X-ray martyrs of the time. Nowadays, patients in dental offices are covered with lead aprons to prevent penetration of the beams to their bodies while their teeth are X-rayed with the approved X-ray machine. Only a short exposure time, a fraction of a second, is required to take an X-ray. Modern dentistry has changed over the past 100 years into a profession that treats patients gently and without a lot of discomfort. High-speed drills do procedures quickly, and local anesthetics do a good job of making the patient feel numb. Root canal therapy, in many cases, can be performed to save abscessed teeth from being extracted. Fluorides in drinking water, rinses, pills, fillings, and toothpastes have made a major impact in preventing decay. Dentures are now made of plastic or porcelain and constructed to fit perfectly in the mouth, without need of springs. Crowns, bridges, veneers, and implants are amazingly natural looking. Skilled orthodontists successfully straighten crowded teeth and align jaws. The next time you visit your dentist for a checkup, look around and see how far dentistry has come from the days of toothworms and spider juice. Bonus section: Inventions by American dentists outside the field of dentistry. Dentist Thomas Bramwell Welch, 1825 to 1903, of Vineland, New Jersey, created an unfermented grape juice in 1869 that he called Dr. Welch's Unfermented Wine. In 1869, Dr. William F. Semple, 1834 to 1922, a dentist in Ohio, was the first inventor to patent chewing gum. Semple hoped that people would be able to clean their teeth with it. Dentist William James Morrison, 1860 to 1926, of Nashville, Tennessee, invented the cotton candy machine called the Fairy Floss machine. In the 19th century, the machine that he designed still works today just as it did then.